I think that was hard. And I think it, really reinforced to me how important having conversations with patients, before they got ill about getting vaccines and getting boosted, how important that time really was. Like that was probably some of the best time I spent in healthcare was trying to convince people to get vaccinated in the outpatient setting. And, it was frustrating and sad and draining to have to take care of patients that maybe would not have gotten so sick if they had been vaccinated. But I also think we've taken care of, illnesses for a long time where patients may have had choices that led to that illness. And I think it's important for us also in healthcare to remember that, we're here to take care of everybody, no matter what, even if that is very personally draining on us. Nearing, as many vaccines or at least first doses as we're going to get, but I'm sure there are still a few wins out there if we keep talking to people. And I think certainly hearing from, a doctor, a nurse, or a family member that they trust may really help. So I think having those conversations still are important, and I hope that we all keep doing it and keep up that energy. But I do worry we're probably seeing a plateau for at least, the first booster or the first series of vaccinations. And I think it will be important for us to really encourage boosters or ongoing vaccines if that's what's indicated going forward. There are many people that are hesitant to get their kids vaccinated. And, personally, we have vaccinated our 5-year-old, and we did so early because we wanted to make sure that she had the best chance of having a mild course if she were to get COVID. And we knew that hospitalizations for kids, while lower than adults, certainly are still higher in COVID than they are for many other illnesses that we vaccinate our children for. And I think it's important, if we can, to really continue to encourage people to vaccinate that school age group, particularly now before we see another wave, if that's what's going to happen in the future. It'd be good to get our community levels up as high as possible. And I think it's encouraging how many people have gotten vaccinated across the world, even in that 5 to 17-year-old age group, and how we've seen really, very, very few side effects. The vaccines are very well tolerated and effective in that group.